Welcome to the second interview of the ACC California Wellness Series. I am Sheila Carr, a practicing cardiologist in Beverly Hills, California, attending cardiologist at the Schmidt Heart Institute at Cedars-Sinai, Los Angeles, and the chair of the Wellness Committee of the California chapter of the ACC. I would like to start off by thanking the California ACC for being sensitive and proactive about the wellness of the cardiovascular healthcare team. I'd like to thank Liana Collins, our CEO, for arranging this, and our Northern California Governor, Dr. Jamal Rana, for his leadership, foresight, and introducing me to Dr. Asim Desai, who I will be interviewing today for the second time. Dr. Desai is a cardiac electrophysiologist and co-director of the Providence Mission Heritage Heart Rhythm Specialists in Mission Viejo. He's the author of the book, Restart Your Heart, the Playbook for Thriving with Atrial Fibrillation. He was the keynote speaker at a recent inaugural Ending Physician Burnout Global Mega Summit. Those of you who did not have the opportunity to hear our first interview on burnout, please visit the California Chapter ACC webpage. Bullet points that were discussed that day were: one, that burnout is a reversible state and can affect everyone in all professions, and if not recognized, can lead to PTSD. Two, it can manifest physically with exhaustion and fatigue, ill feelings at work, like feeling distanced and decreasing work productivity. Three, it converts good stress into bad stress. Four, COVID has made the burnout epidemic into a pandemic. Five, there are self-assessment tools and physician coaches to help us with this condition. Six, social media can be a mixed blessing if used in moderation. Seven, and most importantly, one does not have to suffer in silence or alone. Dr. Desai also mentioned about the ABCs of burnout management, which was A, for awareness of one's physical, emotional, and mental state. B, body movement, being engaged in some sort of movement, especially yoga. And C, for connection with others and compassion. We are now at the close of 2021. Needless to say, it's been a very challenging year. I cannot think of a better time than now and a better person than Dr. Desai to talk about compassion. He recently authored an eye-opening article called "Let's Make Compassion Go Viral." An interesting play on words, I have to say, during this viral pandemic. Dr. Desai, good afternoon, and thank you so much for taking time out from your vacation. I see the background, and for chatting with us today. I have a few questions, and my first question was going to be, how did the pandemic adversely affect cardiovascular health team workers?
Hi, Sheila. Thank you so much for having me. And I'd also like to express my gratitude to you, to Jamal, to Liana, and the California ACC chapter. It's a true honor to be able to participate in this kind of discussion. Burnout, wellness, compassion is very near and dear to my heart, no pun intended. And I think it's really something that has not been talked about as much, especially amongst cardiologists. We tend to be a very procedurally oriented field, very data driven, which is great. But the reality is that none of that matters if we can't actually deliver the care due to any challenges that we may have with burnout or a lack of compassion. So, right now, I would say with the pandemic, and in particular, cardiovascular healthcare teams, I think if you look at the cath lab, for example, even in our own institution, a lot of nurses have left. They've left the profession, especially if they're close to retirement. They're just saying to themselves, I'm not going to put myself at risk or my family at risk for the virus. They're just going to transition out. We have a lot of other nurses that have kind of asked themselves, younger ones that have asked themselves, what do I really want to kind of do with my career? So this pandemic has really made everyone sort of take a pause and reevaluate their career choices. So I would say, in a very practical way, the cardiovascular division, especially at our hospital, I imagine at other hospitals, it's a staffing issue. like we're not literally able to do as many cases. In EP, for example, we have now been limited in the number of days that we can actually do cases, and we can only do cases till a certain time period because we only have one STEMI team on call. So I imagine I'm not alone. I imagine we're not alone, and probably at your own institution, Sheila, and other institutions, we see some of these restrictions. So just being able to deliver the care to our patients, our STEMI patients, our unstable angina patients, our arrhythmia patients, our heart failure patients, is really limited. And I think that happens on the office side too. In our office, for example, a lot of the staff are out because of COVID infection. In California, I think California is one of the leading states now in terms of new cases, especially with the Omicron variant. So it's definitely a challenge in the office and in the hospital, and that affects any cardiologist's day-to-day practice. And then you look at, of course, these huge numbers, and more families are getting affected at home, including the families of doctors. And so that's a big impact on our cardiovascular team as well. If you look at our patients, we all have seen cases where either the infection itself is affecting the heart, people are getting sort of pseudo-STEMI from clot formation. We're seeing a lot of our arrhythmia patients having more episodes get triggered. AFib, for example. We know that having AFib during a course of COVID infection in the hospital is an independent increased risk factor for mortality. And I don't know about you, Sheila, we've even seen our patients who have gotten the vaccine have kind of an increased episode trigger for AFib and for palpitations in general. And then of course you have long haul syndrome. So that's the challenge, is that, there's a lot of distrust that the public has amongst healthcare professionals in general. And when people get the vaccine and get side effects of the vaccine, or they get the vaccine and they get infected, there's a lot of people that think I shouldn't be getting infected if I have the vaccine. And, right, you keep telling people, no, it's not about that. It's about just, preventing a hospitalization or more severe form of the infection. So those are my thoughts on it. How about you? How have you been affected?
I cannot agree with you more. I mean, we have less on the workforce and more on the disease front, and the stress level at every patient, our nurses, administrators, everything is high. And we won't even go to the fact that Medicare is going to be reducing reimbursements, right? I mean, so it's been really difficult, difficult. I'm going to ask you another basic question, shifting gears a little bit. What is empathy and what's compassion?
So empathy is really stepping into someone else's shoes and trying to understand their experience of any particular thing or event or circumstance, and also trying to find a way within yourself to perhaps connect with that based on your own experiences in the past. So if someone just lost a loved one, you sort of thinking back to yourself of maybe you lost a loved one and what did that feel like? So that's empathy. And compassion is taking that empathetic response and then actually doing something about it, having an action. And so the action can be anything from saying a silent prayer for that person to, if you look at the pandemic, for example, especially early on, you had a lot of different groups actually helping older citizens, getting groceries for them and things like that, so they didn't have to go into the grocery store. So that's an act of compassion. An act of kindness is essentially an act of compassion. And we're seeing all these random acts of kindness. And I think one of the biggest challenges, and we see this in the news and a variety of other things, is that all that typically gets reported on are all the negatives of the pandemic. And we don't really hear about the acts of kindness and the acts of compassion. And that has largely to do with the fact that for whatever reason, we are more attracted in general as human beings to these negatives, probably because of our inherent negativity bias from survival, than hearing about these positive stories. Even as physicians, right? Like we may have saved 9 out of 10 lives, but it's that one that we couldn't save that we tend to focus on. And so that's really the difference between empathy and compassion, is that action component.
I'm going to ask you, before we go into compassion in a big way, regarding empathy, can you give some examples how sentences we should say to each other? What's a good place where we can support each other in the workplace? Because right now it's just us, and this is not a training we've ever received at med school level. So give me a few examples. What do we say to each other? I mean, give me examples of empathy that we can do to improve our own relationships and help each other.
Yeah, I think that's a great question. I think, we're not taught a lot of this in our medical training per se. And as human beings and as physicians in particular, we really like to fix things. So if someone's suffering, like if one of our work colleagues is suffering, for example, like we immediately want to offer a solution. And the thing about empathy is it's not really about, it's not like sort of sympathy. It's not feeling bad for that person and then trying to offer some type of help to them. It's really about just sharing that experience with them. So in a lot of cases, it's not actually anything you say. It's about being physically present. It's about making something as simple as making eye contact with that person as they're talking about something, or even as they're not talking about something, but you can see it in their face. So I think the nonverbal methods of communication, eye contact, positioning your body, being more open in your body, rather than your arms crossed, having your arms out and open, those kinds of things right away are acts of empathy and are ways to have an empathetic connection with someone. And then oftentimes what I think about is like, what would I want someone to say to me? And say, for example, this happened to us recently. So a colleague of mine had a pretty tough complication. So, we started doing the Watchman procedure, left atrial appendage perfed, and the person had to go to surgery. And we know that that's an inherent risk with that procedure, but still, it's kind of like, you don't want that to happen to anyone. And then you just feel this personal sense of responsibility. So this colleague of mine, we were just kind of sitting around in the control room, and I didn't quite know how to like talk to him about it, because I didn't want to point to it. I didn't want to have him feel bad about it again. And these are the things that go on in our minds when we're trying to be empathetic for a colleague, right? So I just decided to just kind of keep it open and just say, hey, how's it going? And then definitely like wait. And it's that awkward silence, but sometimes that's what you need to have that empathetic communication. So I just stopped. I just said, how are you doing? And then, say, for example, go, oh, I'm fine. And then you can follow up by saying, how are you really doing? And I think that's the statement that you can ask people when you ask about the kinds of things that we can talk to people about. How are you doing? Because that's such a like common non-specific greeting, right? I'm doing fine. How are you? That type of thing. But then asking again, how are you really doing? And you don't even have to draw attention to whatever they went through. But then if you want, and in this case, I did, because I'm also involved in the Watchman program, I was like, I heard about that case the other day, and I just, I feel for you. I feel for you, or I can't imagine what that was like, or I can appreciate what you may have gone through because I had this event happen with my patient. But you want to be careful when you're empathetic. You don't want to like sort of draw it back to yourself, like to say, yeah, I can appreciate what you went through. I had a complication, and let me tell you about that. It's about the other person. And so, those are my thoughts on communication and empathy. Is always think of nonverbal, always think of eye contact, always think of your body. We have a tendency as physicians, especially to have our arms crossed a lot, and having your body open is definitely a better way to communicate with people. And then I think, things like, how are you really doing, as a follow-up question to how you're doing. And then if you know about that person's experience, saying something like, either I can't imagine what you're going through, or I can appreciate what you're going through, and then share whatever experience you have that may have been a parallel.
And then there's another thing that, as in cardiology, we're supposed to be strong. And so I think it's also like, at what point should you succumb to saying, oh, I'm having a lousy day, or really that case to, so it's difficult. At what point can we share with a colleague and not appear weakened or, burned by it? It's tricky.
It is. I think you raise an important point. And I think one of our concerns in asking someone about how they're doing is, we're all pressed for time, right? Like we're all running around, we're running at the hospital, we're at the office. And so if you run into a colleague, like if I run into a colleague and I have office in like 5 minutes and I'm over on Cartel, and I know that they went through something tougher, I can tell, it's kind of hard to have this like in-depth conversation when you have to be somewhere in 5 minutes, right?
Yes.
And so I think that's where, really just, it's the not talking sometimes. It's just the kind of
the feeling
more,
that I am around for you.
Yeah,
or
exactly.
I understand.
Right, exactly. But I think we're always so worried about like opening this can of worms if we start asking people about things. And you're right, as cardiologists, we're supposed to be strong. And, going back to the example I mentioned about the Watchmen, this colleague of mine, it kind of opened up this conversation just in general about our career. We're both about the same age. We are both in that place of asking, do we really want to do this for the remaining part of our life? Or are we reconsidering other career options? We're both working with physician coaches, kind of addressing those issues. And it really opened up this very, very personal discussion. I mean, we both talked about some times that we were both really, really depressed in what we were doing at work. And I was shocked. I was shocked to find out that this person had these kinds of feelings, because it always came off as really, really strong. And that's the thing, is that, I think if you're a human being and if you have a soul, you can't be strong all the time. You just can't.
Right. Now I'm going to hit the last question, which is absolutely your cup of tea, is how can we create a compassion pandemic or make it go viral?
Yeah, and I think that's the key question is, how do you put this stuff into practice? Now, first off, a lot of people think that empathy and compassion are like sort of these inherent traits that either you have or you don't have. And even the person that may come across as the least empathetic, least compassionate, it's a skill. And so if you're willing to invest the time, and it doesn't take that much time, to learn about how to adapt some of these skills and put them into practice. And there's tons of resources. I mean, there's resources online, there's YouTube videos, there's apps, all sorts of ways of building compassion and building that as a skill. And then it has an infectious quality, because the more compassionate you are to someone, I call it the win-win-win. So say, for example, there's someone and you're empathetic with them because, they may have lost a patient, like if we take that example. And then you do some kind of, you do something with it. So maybe it's like grabbing them a cup of coffee. Like that's your compassionate act, because they're say they were up all night on call. Say you had another colleague that was up all night on call, bringing them a cup of coffee and just kind of sharing that cup of coffee together. That's an act of compassion. And then that person feels better. You feel better because you did something for someone. And there's a lot of science that shows that doing things for other people automatically increases your well-being. You get this dopamine hit, you get this oxytocin hit, you get this neurochemical boost. And then what ends up happening is, as more and more people are helping each other in this sort of domino effect, you get this upward spiral. And that upward spiral can occur in a hospital, in a clinic, in an institution, Cedars or mine, Mission Hospital, or in a region, in a community. And that's really what we're trying to foster, is this sort of domino effect of helping each other. And I think as physicians, we are so used to helping everyone else and not taking care of ourselves. And it's almost frowned upon when you want to, exhibit some self-care and draw some boundaries and say, you know what, no, I'm going to say no to this and take care of myself. And I think that's really shifted. I think this pandemic, I think the increased, suicide rates amongst healthcare providers, depression, anxiety, I think that's really shifted. It's become a more open conversation, like what we're having today, right? I mean, we wouldn't have had this kind of conversation 5-10 years ago at the ACC. So I think that, just being willing to just take that step out there, and it's hard. And I have to admit, like for a long time, I was very closed off. And I think I had to go through some really rough times to then realize that, I have to be open about this, because there's no point in suffering in silence. And some things that may help some of the viewers here today, you can do a variety of different personality profiles. A lot of them are free online, that basically help you understand yourself and your values and kind of how you operate in the world. And sometimes that's very useful, because then it gives you like this sort of terminology, and it helps you understand perhaps some of the other people around you. And, oh, that person must, be more of an extrovert, or that person must be more of a charger, like these different personalities. And then that can help you communicate with other people and show those acts of compassion even more.
I mean, in my simplistic mind, so what I took from this is the big H word, helping each other. And another simple theory I have in my mind, and I don't know if it'll work for anybody else, when something belongs to you or you belong to somebody, somehow this whole compassion, empathy comes in. So like I have this little way I live my life, again, not right, not wrong, I don't know, is I always feel that I belong to everybody and everybody belongs to me. So when I have that theory, so automatically I will want to help the person in the field who I'm working with, because we belong to each other and we belong together to help others. Does that make sense?
No, it totally does. I mean, we are social beings. I mean, we were created to be social creatures. And I think our whole society, especially after the Industrial Revolution and now the technological revolution, we are really, really further apart from each other. We live in these individual silos. And I think you making that statement is such a powerful statement, that we belong to each other, that we have each other's back. And because if we think that we're never going to encounter any problems, I mean, that's sort of deluded thinking. And we're all going to have challenges in different ways, and we all probably have a lot more in common with each other than we think. And one more thing I wanted to add to that is, one way to learn about how to be compassionate is to practice self-compassion. So self-compassion, and these are like discrete sciences, like you can Google this. Self-compassion, there's what's called a loving kindness meditation, and there's science behind this from the Mayo Clinic, from Stanford. Those are two leading institutions looking at this stuff. A loving kindness meditation is basically saying to yourself, may I be at peace, may I be happy, may I be safe, may I be healthy. You kind of have a set number of sentences, and then you turn it towards someone you really care about. And you say, may you be happy, may you be safe. Then you turn it to someone that you're sort of indifferent to, like maybe the Starbucks barista down the street. May you be happy, may you be safe. Then you turn it to someone who you may have a challenging relationship with at work, at home, and say, may you be happy and may you be safe. And then you do it to the whole world. And there's some science that shows that this loving kindness meditation really helps you begin to kind of have this muscle memory. Like you want to create this neurologic muscle memory for what it's like to be compassionate, because compassion, empathy, they are not inherent traits. They are skills that can be learned, and there's a lot of resources out there.
Wow. I kind of think of a better time to talk about this as we close the year, because this will make us think about gratitude and compassion as we close the year and automatically begin a new year. Dr. Desai, on behalf of ACC and all our cardiovascular caregivers, I cannot thank you enough for chatting with me for the second time and being a catalyst to enhance well-being of our cardiovascular team members, thereby giving better patient care and helping the community at large. Thank you again. A very happy, healthy new year to you.
Happy New Year to you as well, and to all the viewers. Everyone, just be safe and take care of yourselves and your loved ones.
Thank you.
All right. Bye-bye.
Bye.
Thank you both.
Thank you, Liana.